information and photographs contained in this presentation are the property of Candela and its consulting physicians and is being provided for educational and discussion purposes only. By sharing this information, neither Candela nor any of its consulting physicians give you the right to use the information presented. By participating in this webinar, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the webinar. With that, I'm very pleased to introduce Dr. Konika Schallen, VP of Clinical Operations and Medical Director at Candela, and owner of MedSpa, the Center for Modern Aesthetic Medicine in Jacksonville, Florida.
Thank you, Grace, and good evening to everybody out there. Thank you so much for joining us on behalf of the team at Candela. Tonight, we're very pleased to be able to bring you Dr. Matthew Mahlberg, who is joining us from the Colorado Center for Dermatology and Skin Surgery. And Dr. Mahlberg is an expert in dermatology and skin surgery and many years of experience with the Nordlys products and the Ellipse products. And so we're very pleased to have you join us this evening, Dr. Mahlberg. Dr. Mahlberg is a board-certified dermatologist and Mohs surgeon. He did his undergrad. He's a Colorado native at the University of Colorado at Boulder, and then went to University of Pennsylvania for medical school and found his way back to Colorado. So that is wonderful to have you join us tonight, and we're so excited to see some of the cases that you're going to present from your practice and show us some of your tips and tricks and pearls. And so with that, I'm going to turn it over to you to tell the group more about how you view the platform.
Sure. Wonderful. Well thanks. So I really do enjoy talking about this device in particular. And like we talked about at the very beginning of the talk, we have a whole host of different devices in our practice, but the Nordlys device has really been a stable and very reliable and very effective workhorse for our practice. I'll back up just a little bit in terms of the history of our practice, just to give people a little sense of that. When I started our practice, I kind of embarked on a several-month process of evaluating a number of different devices. And what I found to be true was that for the practice that I have, and I think for many aesthetic practices that were started or sort of looking for those staple devices that were going to be things that were consistently helpful for our patients that would perhaps check the box for 80 to 85% of the cosmetic complaints that an energy-based device would touch. The Nordlys fit a lot of those checked a lot of those boxes, and in particular, the ability for having a non-ablative resurfacing device like the Frax 1550 and the vascular capabilities, which is the topic that we're really going to touch on tonight. But having all that into one very effective, useful device with a great user interface was really helpful. My background with it, so I've been using the Nordlys devices for 6 years and have had my hands on them every day of the week in my practice. And so can speak to all of the applicators and how to use those. So certainly at the end, we have Q&A session. If there are current users or prospective users, would love to answer questions about how I use it. But the Nordlys is composed of a handful of different applicators and applications. And that's one of the unique things about it in one platform. So the selective waveband technology, or SWT, is a narrowband IPL that is useful for pigmentation, vascularity, and hair removal. We'll talk a little bit more about what SWT means in the next couple of slides. The other applicators that are on the device include a Frax 1550, which is a non-ablative fractional device for deep skin resurfacing. So in this circumstance, you can think acne scars in a non-ablative fashion and improving those. I use it a lot in my practice for surgical scars post-operatively, just to help blend those in. 1940, which is kind of the new kid on the block, which I've really enjoyed using, which is a non-ablative fractional device for skin resurfacing and the treatment of benign pigmented lesions. The Frax 1940, think of that as kind of your bronze tennis player golfer who just needs to blend in a lot of lentigines and resurface the skin. And that's been a home run for our practice. That's probably one of the most popular treatments aesthetically. The ND-YAG 1064 is wonderful for vascularity. You can also use it for nails. It's sort of an indication that was in Europe. And then we use it, some of my colleagues use it for wart treatments also. So in all, there's 22 FDA cleared indications. One other fun thing that we did a couple years ago was working with the Candela team was developing this light and bright treatment modality. And this is sort of stacking multiple applicators on the same treatment date and getting just wonderful results in one treatment session for people, and sort of demonstrating the safety of layering those treatments on top of one another, whether it be Frax 1550 or 1940 with some of the selective waveband technologies. So we'll show a couple examples of that. But again, our focus tonight is vascular, so I won't veer too far away from that. Let me just advance one forward here. So just to show you what the applicators look like for those in the audience that haven't used the Nordlys before, here's an example of 4 of the vascular treatment applicators. So again, our focus tonight is primarily on vascular, but these applicators are used for those. So the Nd:YAG 1064 is the one that looks a little bit like, I like to say it looks like a blaster from Star Wars, because I'm a big Star Wars fan, but it's an incredibly effective Nd:YAG device for benign vascular lesions. So think of this for facial telangiectasias, leg veins, thicker blue veins around the eyes or the nose, and then it can also be used for warts or onychomycosis as described. The SWT PR530, which is the one in the middle there, which is for vascular complaints, and then the SWT VL555, which is also can be used for pigmented lesions, and then blue or deeper vessels as well. One of my favorite applicators is this one that's kind of in the front left, which is the PRS applicator. And the nice thing is that, you know, I sort of came from a laser-centric training program at NYU, and so we used a lot more pulse dye laser therapies, and so we were really used to using that 7 to 10 millimeter spot size for many of the treatments that we did. Band light or intense pulse light, the usual thing is to have a crystal, which is often a lot larger. And that's nice because it's a much more efficient treatment, because the treatment zones are larger per spot. But sometimes you just get used to those smaller spot sizes. And the PRS is one that is just fantastic for treating those nasal telangiectasias. And I'll show you some examples of that a little later in the video. So a little bit more about the selective waveband technology. We'll kind of go into detail about what that means to the other devices. And it's sort of what makes the Nordlys unique in my mind in terms of intense pulse light, because intense pulse light is typically conceived of as broadband light. So there's broad spectrums of wavelengths using filters to filter out certain bands of light that you want or don't want. These broadband light IPLs run the electromagnetic spectrum, or the light that's emitted, all the way up to 1400 nanometers. Okay? When you get up to above 950 nanometers in particular, your main chromophore is water. And so the treatment above 950 is primarily causing some skin heat. And so you have to use external cooling with the treatment. This is with a lot of the other IPL devices. And when the more heat you have, the more risk you have for skin burns with IPL. And that's just not great and not safe, and that increases the risk of hypo or hyperpigmentation. With narrowband IPL, which I think the Nordlys device provides, you narrow the wave bands of light and you remove some of those potentially harmful wavelengths. So think the wave bands or the light wavelengths above 950 nanometers, which are the ones where water is your primary chromophore. And so, selective waveband technology is essentially a specialized form of a risk-minimizing narrowband applicators that delivers more precise IPL. And by being more precise, you can use 50% less fluence than broadband IPL. The lower energy keeps the pain control, less discomfort. You have less risk of injury to the skin and adverse events. And you can treat and layer multiple treatments in the same session, as I was describing with the light and bright treatment. And that's really unique, because a lot of times if you're doing one treatment with a broadband IPL, you know, layering a non-ablative fractional laser might be too much energy for the skin to have. But because we're keeping our fluences lower and our efficacy high, we can still accomplish that very safely. The foundation, the selective waveband technology, or SWT, for delivering optimized vascular treatments. And that's really the topic tonight, is how Nordlys, as an IPL device, provides a high standard, a very high standard, an exceptional standard of providing vascular treatments. And so let's do that. First and foremost, it uses dual light filters. So light filters that are, instead of just being on a lower end of the electromagnetic spectrum of light emitted, they have light filters on both the bottom and the top end. They do that using a water filter through the handpiece. So water filters through the handpiece, and that secondary filter that blocks the wavelengths beyond 950 and minimizes the risks of burns and the hypopigmentation and the scarring. And because you have lower fluences, no external skin cooler is required. Why is that important? So many of the IPL devices that we'll use, they do use broadband light, use an external cooler, and you apply that to the skin. Well, we all know what happens when you put cold on a blood vessel. It shrinks. And so when you're trying to treat vascular targets, when you shrink the target, you lose your target, and your chromophore is not there to absorb the energy. So the nice thing here is that we don't have external skin cooling, and that actually allows for a better vascular treatment result. And then there's customizable pulses. So you have the ability to use the expert mode for control of the pulse time, the delay, the number and the sequence, and again, lower energy to target those desired chromophores. And you can even provide, and this is what's really, really unique about Nordlys, and I wish this was bold letters almost, but sub-millisecond pulses to optimize the vascular treatment. So for those of us that are used to pulse-dye laser, when we're treating a port wine stain or some erythrotelangiectatic rosacea with just that blush of pink in the background, we're going to talk to the patient about using the possibility of purpuric treatments that are sub-millisecond that might provide either flash purpura for us as the provider as our endpoint, or some purpura that lasts for a few days to get them to their clinical result. And most IPL devices do not provide that ability. And so that's very unique for Nordlys to have sub-millisecond pulse durations.
Yeah, I agree with you. That really is one of those highlightable terms, right? The sub-millisecond is really a big deal. That's what makes pulse dye laser so impressive, the ability to go under 1 millisecond. And it's the only IPL that can get that short, thereby treating really, really fine vessels.
Right. And I think that makes back to what I was saying when I first started, when I was looking for a device that had the ability to do the, really granular treatments as well as non-ablative fractional resurfacing. This was kind of the only one I saw that really provided me with that opportunity for pulse dye laser type treatments, as well as, that non-ablative fractional treatment. And then I've sort of proven that to myself over time, over the last 6 years. So again, what is this about? You can really customize the pulses, the pulse time, and again, getting as short as 0.5 milliseconds, the delay, number of pulses, and sequence of pulses to really optimize the vascular treatments. And I must say that there's so many built-in preset settings that when manipulated work so well with the user interface in this device that it is infrequent that I need to go into expert mode to do this. But it's wonderful to have that opportunity, and the thought that went into all of those preset settings is fantastic. So again, when you have little small vessels, and we'll show some examples of this throughout the slides and some of the case studies, having the opportunity and the ability to treat thin vessels with very short pulse durations, that's typically used in pulse dye lasers. And so that rosacea-associated diffuse redness is so difficult. Otherwise, port wine stains is very difficult without sub-millisecond pulse durations. And you have the opportunity to do that here, which is fantastic. So we'll just kind of scooch along. Just to show this kind of in one more way, here is a diagram of our typical electromagnetic spectrum that we see if we're at all involved with laser or light devices. And I'm going to try to point this out with words. You can see I may try to put an arrow or two just to point out what I'm talking about. With the SWT wavelengths, the PR applicator runs the following narrow spectrum. It goes from 530 nanometers to 750 nanometers. So that narrow band. It's a broader band than the single wavelength KTP laser, which is 532. So it provides a range of depths for reaching blood vessels and targeting the hemoglobin, oxyhemoglobin that you want to go after for vascular treatments. Because it has that upper filter, and I'm just going to click right here just to show you guys, at the top of that range at 950, that circulating water filter stops the light from going beyond there. And what you can see is that beyond 950, the blue line here represents the absorption of water, which is the primary chromophore above 950. And so by having that secondary filter, we're really narrowing the band of treatment and making it much, much safer. One other thing that happens when you're in this sort of 532 to 950 wavelength band is that pigment also has formed that area. But because our fluences can be decreased and we have such range with our pulsation, you can really minimize the unintended impact to melanin during the treatments. And I'll show you a picture a little later of a gentleman that I treated with long pulse PRS, which we'll show you. And he had a ton of melanin, but I didn't feel the need to treat his melanin first or strip it away before I treated the vessels, and he was totally safe and had an amazing result. So the penetration, because you can either use the PR or the VL. VL is going to go a little deeper. You can treat deeper vessels or use the Nd:AG to go after even deeper ones. And then the SWT maintains a 20 degrees Celsius or room temperature applicator surface because you're not cooling device, because you're using a safer fluence that's lower, so you don't need to cool. And that prevents vasoconstriction that can be seen with a number of other broadband devices. And so therefore you can see the vessels better, you can see your treatment reaction and ensure that you're getting the reaction that you want. Because I think when you treat with lasers, it's all about the clinical endpoints. And that's really what I want to show the rest of the time during the talk here.
There's a lot that was in that last slide there, but I think that it's so important because it talks about how laser-like in a way that the PR applicator in particular can be for the treatment of redness. And you're going to show us some of your cases with treatment of vascular abnormalities, and that PR 530 really hits not just 530, 532, like you mentioned, the KTP laser, but continues on to the 700 range. And so it gets into the 595 range. It gets into the other ranges that are so important to treat oxyhemoglobin.
Absolutely. I think when we think about, which lasers do we pull off the shelf for vascular treatments, it's KTP, so your 532, your pulse dye laser, your 595, and your Alexandrite laser, which is 755. And so those are really our vascular lasers, and you're kind of covering that whole spectrum in one device, which is nice. So that's that PR applicator we'll start with, and I think we'll see some of the real benefits of that. So.
Well,
let me click ahead here. So for the rest of the talk, what I'm going to do is just describe some cases and give a little. We'll talk, in some cases, particularly about settings. But I think the points that I'd like to make for everyone listening is that settings are important as a baseline, but really what we want to see are clinical endpoints when we treat people with energy and light-based devices. We really want to make sure that we're seeing the changes that we want to see and not just dialing in numbers and hoping for the best. Some of that as we go along here. We'll start with a case of diffuse facial bang, which is one of the most difficult with energy-based devices and to get a consistently good result. And so this is a patient of Dr. Michael Drosner's from Germany. And this is on the left, kind of that baseline diffuse erythema that has made composed of tiny little blood vessels that require short pulse duration to treat. And here is treatment using short pulse duration PR 530. So what's important to note here is that on the left, typically a patient you would say, this may be somebody who's referred in by their primary care physician, who's been giving topical metronidazole cream, which of course doesn't address the true flushing and erythrotelangiectatic rosacea that they have. And you might think, well, let's treat it with a pulse dye laser using purpuric settings. But here, the PR 530, because of that sub-millisecond pulse duration, you're able to accomplish the same result.
With that last treatment, Dr. Mahlberg, if you were to do that, what do you think the treatment endpoint would be for such a dramatic result after one treatment?
Yeah. Yeah, this is a tremendous result from one treatment. I think if I was counseling a patient on the left, I would say, I think you're in for 3 to 4 treatments. This is pre any treatments, what I would suggest. I think I would say you're in for 3 to 4 treatments and probably an annual or semi-annual touch-up, because they clearly have a genetic predisposition to this. In terms of clinical endpoints, I would be using 0.5 to 1.5 millisecond pulse durations for this patient, and I would be looking for flash purpura on my first treatment setting. So the first time I saw them, I would look for that flash purpura. I'll show you an example of that in one of the slides ahead for a scar that we treated. So that's purpura that lasts for only a few seconds and then resolves. And I would treat across the entire surface of that with one pass. And then I'd probably see her in 4 to 6 weeks and evaluate the response and move forward from there. If the patient was very ambitious and had a limited number of treatment opportunities, then I think we would actually be looking for purpura in the first treatment course. But I generally like to sort of ease patients into that. I think this was a clearly very motivated patient who probably had purpura across. What would be your thoughts, Dr. Schallen?
No, I agree. I think she's got quite a lot of chromophore there. So to get a dramatic result very quickly, I imagine that she had some purpura with some short pulse durations. One of the other things that I might try if somebody definitely wanted to avoid purpura is maybe even lengthening the pulse duration to 3 milliseconds and using it very, very similar to the parameters in the pulse dye laser at, 7.2, 7.4, 7.6 at 3 milliseconds. Again, trying to find flash purpura or blanching, but no purpura. I'm going to try your even shorter pulse durations next time.
Yeah. It's like living life on a high wire sometimes.
Yeah.
and just so if all of our listeners don't know, purpura is bruising. Purpura is bruising, so this is induced bruising to help remove vascular areas, and it's commonly necessary for port wine stains and for this. And I'll show you an example of that here. So here is a patient with a small but to him very significant port wine stain that he had had his whole life and had been to treatment with, he'd had IPL to it with no response in the past. In a different setting, and we sat down and we said, yeah, we can get rid of that. And so what I love about this picture is it just shows the immediate post-treatment clinical endpoint. So this is a port wine stain composed of many small capillaries. And so what we used here was the PRS applicator. So again, small spot, 7 millimeter size to that hexagonal handpiece clinical endpoint. Which was, we think we did one pass and about 7.5 joules and 1.5 milliseconds. And he got that clinical endpoint, and after treatment, it was resolved. And that's pretty effective with treating these port wine stains, even for small ones, to get that degree of clearance after one treatment is pretty fantastic. So have you?
Yeah, that's great.
You used a lot of this on port wine stains, Dr. Schallen?
Yeah, I have, especially adult port wine stains where patients have had this for a long time and they're fairly light, or sometimes with patients that have been treated many years with a variety of devices, including pulse dye laser, and you have a residual light port wine stain and have had really good success with Nordlys on the face and body. We have a question. If I could take a quick question before we... Yeah. There's a question from the audience if we can stop and take a question before we get on to the next slide, and that's about post-procedure bruising. Do you use it at all for post-procedure bruising? I
do, and if they'll hold on, I've got a great picture of just demonstrating what the PRS can do for that. So it's in about 7 or 8 slides. So we'll definitely get to that.
Sounds good.
And I think that really speaks to, can this stand used to with Roy Geronimo's group had a paper about that, but we'll get to that in a few slides. Let me just show the treatment of the vascularity associated with a scar. And this is primarily to show that in a medical practice, I think we can really help people by treating scars, by improving our own results when there's some extra blood vessels or telangiectasias or just background erythema. But this video is primarily to show just a bit of flash purpura and what that looks like. So for the clinical endpoint of that, I'll just click on the video and let you guys see this. We're just going to treat along the surface of the scar. What you'll see is a slight graying along the incision line. It's specific to the redness of the scar. It turns kind of a grayish purple color, and that's a clinical endpoint. You can see in the photo there that it ends up with. That's a clinical endpoint that we want to see when we're treating scars. And I love Nordlys because if there's ever a hint of blood vessels around a surgical scar that I've created, we'll whisk them into the room, we'll put a little cooling gel on their skin. They're gone. They're thrilled. And even when there's background erythema, as in with this, this is a melanoma removed patient, just to remove that redness and kind of help them eliminate that from their memory is, I think, a really helpful thing.
What about fracs? Do you like to use the fracs on the same day over that?
I will sometimes. I think if it's just background erythema that I'm treating, then I won't typically. But if there are linear telangiectasias and they also have a little contour, on the scar that I don't love, then I will treat the PRS always on my device. We'll treat the blood vessels first for those linear telangiectasia, nose or the cheek or the forehead. Usually we're using either the 10 or the 13 millisecond pulse duration to remove the telangiectasias around the scar. And then we will go ahead and treat right over that treatment that was just done with the PRS with the Frax 1550 typically for scar treatments. And same session, same time. We usually do that starting, 6 to 12 weeks after the procedure. We like for everything to stabilize and for nature to run its course for the incision. But that's usually the time frame we'll start that.
That's good to know.
What's really helpful to me, just to comment further about the Frax piece, because there's no consumable portion to that Frax treatment, it's something that's a value add that I can do for my patients, but that I don't have a consumable handpiece for, which has been very helpful, just to be able to do it and feel good that it's getting done. The next thing we're going to show here is a couple of treatments. This is sort of layering VL and PR 530. This is in a series of treatments. This is by Dr. Simone in Spain. What I think I wanted to point, peel away some pigmentation before you treat the vascular lesions. And in this patient on the left, you can see some background hyperpigmentation, as well as a number of linear telangiectasias. And so treating first to remove some of the pigment using the VL 555, and also with the VL 555 getting some improvement in some of the deeper vessels. Treatments with PR 530 can be a nice kind of approach to sequentially improving somebody just as dramatically improved between those two treatments. Similarly, just to remind everyone that the VL 555 is a portion of vascular treatment. Here we have some sort of, a little bit more bluish or violaceous port wine stain changes. And I find that as people mature from childhood to adulthood, they often have some thickening of their port wine stain and a little bit more blue discoloration. And the VL 555 can be very helpful to target that in a way that sometimes the PR applicator doesn't quite get deep enough to eliminate some of those vessels. And this is a great case by Dr. Drosner as well.
There's a question from the audience about treatment of port wine stains and what you do with the lighter skin around the port wine stains, how you tend to treat that. They're asking, do you cover the lighter skin?
So no, I think we're using and looking for that. That's the wonderful thing about light-based devices, right? We're looking for that magical number that provides the right fluence or energy level with the right pulse duration or how long the energy is pulsed over, and the right spot size, and trying to find the chromophore that pulls that redness and sort of goes after the redness or the discoloration without harming the surrounding skin. So I don't mark off or the intervening skin. I don't know if you do, Dr. Schallen, if you use anything in that regard.
No, and I sometimes am surprised to see some purpura come up in areas that are adjacent, and it makes sense because underlying the tissue, the vasculature is certainly there. We may not see a lot of redness at the top, but even right next to what we see as redness, when you treat the adjacent skin, you'll see some treatment endpoint there. So definitely treating the whole area.
Yeah, and sometimes you pull away pigment, or or you're treating vascular things, the blood vessels that are very small, and it's amazing how precise light is, right? When it just finds those little vessels that you didn't maybe even notice were there, and you can see them turn purpuric in a very specific fashion. So this next video is, we're going to switch gears a little bit from short pulsation to longer pulsation. So this is going to be 10 or 13 millisecond using the PRS 530. And this is just, again, another video to demonstrate the clinical endpoint. And so this is a gentleman who had some large kind of ropey vessels on the cheek that we decided to treat with just a proof of concept, the PRS 530. We chose this just to watch the changes happen a little bit more specific, and you can see those vessels clearing up there with just a hint of background erythema, but the vessels are literally disappearing before our eyes as we treat over the top of them. And you can see he's not in any discomfort. He's holding very still without topical anesthesia and tolerating that very nicely. So you could certainly use the larger PR applicator for that and cover the cheek much more quickly. I found, though, that sometimes when I'm just treating a small area, the PRS is nice from a degree of energy all at once. Some patients, though, would prefer to go for the gusto and just do larger treatment areas and fewer pulses. But this is one treatment just using the PRS applicator, and you can see a marked diminishment in those linear telangiectasias. Again, if I saw the patient on the left for a consult, I would say, this is probably a 3-treatment routine that we'll see you back for, and then we'll target vessels of different sizes each time. And we might come back on the right with either the VL applicator, just to go after some of those deeper vessels, or Nd:YAG. But I bet even another course of the PRS or PR treatment with 13 milliseconds would get us close to that. You can see I was actually under-treating here. If you look at the settings, here we were using PRS applicator at 11.6 joules in 13 milliseconds. I think, you could come back and treat with 12.6 to 13 joules and probably clear out the rest of those very effectively and safely. But that's just a highlight, I think, of a really predictable and nice result that you can provide for patients. This is a similar patient who had a more diffuse erythema in the background, and you can see he has a lot of pigmentation as well. And so classic teaching would tell you first treat and remove the pigmentation, and then substitute some of the vascularity, because you want to clear out the pigment so you don't have competing chromophores. But I think because the Nordlys offers us that ability to use a lower fluence to provide the same benefit for vascular treatments, here we were able to sort of ignore conventional wisdom and go ahead and treat just the vascular component without regard to the pigmentation. And you can see we certainly should and could treat the pigmentation. But in his circumstance, he was really just concerned about the erythema and the background vascularity. And this was with one treatment using the PRS, 13 joules, 13 milliseconds, and he was just overjoyed and ecstatic. And we said, do you want us to come back and clear up any more of the vessels or pigmentation? And he was so happy that he was great. I thought possibly, as I started into this case, that I might need to use some flash purpura-like setting, short pulse duration. So I wasn't sure if pigment would become a competing chromophore, but as I treated along and just saw the redness disappear, it was clear that we could just do the longer pulse duration and get great clearance with that and safely treat them in one treatment.
That's very interesting, because you're right. I would have looked at that big mass and thought, well, should we go ahead and be treating that as a diffuse redness type of picture? So that's really a beautiful change there.
Yeah, I usually start with the longest pulse duration and then sort of work shorter, just to see what we can accomplish with long pulse, no purpura type treatments. This is again some slightly smaller vessels. We use both the 10 millisecond and the 13 millisecond pulse duration here to achieve a similar result. Some of these little round dots that you see both in the mid-chin and on the patient's left, those are sometimes a little bit difficult to treat, but she did very wonderfully with that. And then just transitioning forward. So we talked about PR. We talked about PR in terms of short pulse duration. We talked about it in terms of longer pulse duration. But let's move on to talking about combination treatments with PR and then introducing the Nd:YAG 1064. So in this patient on the left, you can see he had inflammatory rosacea. And you can see the kind of papulopustular and background erythema on his right cheek. And then you see these coarse, ropey venules on the nasal dorsum and nasal bridge. And so we brought him in for a single treatment, kind of combining the PR 530 for the cheek area, using, sort of the 10 millisecond pulse duration. Used the Nd:YAG for those larger venules on the nose. You'll see that his inflammatory rosacea is not improved by noting the large pimple on the right tip of his nose. But clinical appearance and the redness is markedly improved. Here's a frontal view of those venules, which are challenging to treat with pulse-dye laser because of their depth and size. And so that's why we opt, and I think would be a challenge to treat with the PR applicator as well. I think the VL applicator could have been a choice here. We could have chosen that, but I think the Nd:YAG, having that in hand, it was just the perfect treatment. And you can see the settings are at the bottom. With one treatment, had that great result. We'll show a video kind of demonstrating what that treatment looked like, and we can talk about that a little further if you'd like. My approach for these Nd:YAG treatments is to start for the more distal vessels, and I can kind of occlude the more proximal portion if necessary. I'm just highlighting the extent of those vessels there. Now we're going to apply that Nd:YAG applicator here. You'll see it has this nice red aiming beam. It's very precise, tells you where you're treating. We're using a 3 millimeter spot. And the idea behind this Nd:YAG treatment is you're kind of spot welding the vessel. You're not hitting every square millimeter of it. You're just sort of spot welding along the extent of it. And in so doing, you can close off those vessels and get a really nice result with that.
Can you talk about a little bit about the user interface on the Nd:YAG and how that's, if that's been helpful at all as you began to really get to know the device?
Absolutely. Another example, we'll have to suffer. Yeah, so the user interface is this very ergonomic, kind of gun-shaped, pistol-shaped device. It has a couple of different lenses that you can use, whether you need pressure or not. So there's a sapphire lens you can actually occlude if you're treating a spider angioma, for example, or a horseshoe-shaped one to get around those nasal telangiectasias and the nasal ala there, which is what we were using in that video. But what I really love about the Nd:YAG is it's very comfortable for patients. There's a soft, cool, blowing air that helps cool the surface of the skin. And my favorite part about it is on the tip, and we'll sort of maybe demonstrate that with this video here in a moment, there is this black bar that is a cooling bar, and it actually cools very, very cold. It's almost like the inside wall of your freezer. It's not quite that cold, but what it does is Nd:YAG is a risky device, right? It is a tremendous amount of energy in a short pulse duration. When used correctly, it's amazing and it provides great results, but you do run the risk of having too much energy all at once in one location. And so the nice thing about having a cooling bar, it's a safety device so that when you see too much energy go in, you might see some graying of the skin that makes you feel a little nervous. I just put that cooling bar right on the skin, and it's a heat sink. It pulls that heat right out of the skin, and I think really avoids any adverse effects that way. So the user interface is great. The actual computer program of it too provides some really useful settings that allows you to select the energy and the pulse duration you need based on your target size. And so a lot of that is dialed right in the device in a way that's very effective.
Oh, thank you for that. I think you're right that those 3 different tips are really unique to using this Nd:YAG. It's also really nice to be able to just program in the size of the vessel, and the spot size changes for you automatically, which I thought was very comfortable as a user.
Absolutely. Patient that just had these thick, coarse nasal telangiectasias or venules, and with one treatment, markedly improved. Here's just a quick little video on that, just to demonstrate that one more time. See what it shows there. So hopefully you can see we're just going to spot weld along the course of the vessel, spacing 3 to 4 millimeters between our spots, and that aiming beam is just so precise in terms of where you're touching the vein. It really helps you to know that you're getting the right area. And you can see right behind that little circle there was a black bar, and that's what Dr. Schallen and I were talking about in terms of having that ability to cool things down. The nice thing about having this all-in-one device is you have this this applicator, this 1064 Nd:YAG, and patients come in with these complaints, like large venous lake on the lower lip. This was actually a laser scientist that I treated, and so he knew all about lasers, and he was really excited that we could eliminate that venous lake with one treatment. The neat thing about the Nd:YAG, when you treat these large venous lakes, it's a tremendous amount of energy, and it almost feels like you're thumping the skin. Like it's almost like a palpable thump to the skin. The clinical endpoint here is the collapse of the venous lake, but also you'll feel just a little bit of firmness under the skin, and that tells you that you've kind of reached your clinical endpoint. So that little bit of firmness resolves with time. Just so if people are getting started with that, they know that that's okay, and it doesn't permanent scar underneath. Here's some periocular complaints, periocular vessels. This is a kind of a large hemangioma that had been cauterized by someone before without success. We were able to improve that with one treatment of Nd:YAG. A quick comment about treating around the eyes, and we'll show one more picture of some periocular veins. This is a procedure with an Nd:YAG laser that you need to be very careful with. The Nd:YAG goes quite deeply into the skin, and so you can cause vision injury if you're treating here. So if you're going to ever treat anywhere, I say anywhere within 2 centimeters of the eye, even closer, you always want to be outside the orbital rim. You're going to use the Nd:YAG. Secondarily, I always use scleral shields or ocular shields, metal ones, to just prevent any potential injury. And I think that's an easy thing that we as dermatologists and medical providers can do for our patients just to increase their safety. Similar thing here for these periocular blue veins, just a really nice result for patients to remove those as well. And these all and have my assistant actually hold a cotton tip applicator along a 2 centimeter stretch of the vein just to blanch it out. And then I'll pulse along the course of that vein, just here and here and here, with the ocular shield in place and outside the orbital rim. But by them holding on to the vessel and occluding it, we're looking for the vessel to collapse, the blue to go, no changes on the skin surface. I think when we can accomplish that, that's a good sign that we're going to have good clearance of that vessel.
Yeah, that's a beautiful result.
Again, just small cherry angiomas. This is an easy thing. It's such an easy device to use, the Nd:YAG. People have dozens of these, and they're just so happy when they can remove lots of them in a single treatment session. And then this gets to our patient, our question that we had earlier. So I just want to touch on this real quick. Post-procedural bruising. Geronimus's group published this 12 years ago. It had been published as well in a plastic surgery journal. Pulse dye lasers are classically used for removing post-procedural purpura, and it's such a nice value-add thing to offer your patients if they come in for filler or they have a large surgery and they say, you know what, they call 2 days later and they say, I have some purple bruising. What can I do? I have a big event to go to in 2 days. So we bring patients in classically with the pulse dye laser with the V-beam perfecta, and we would treat those bruises, and you would see diminishment of them much faster. We can do the same thing with the PRS or the PR applicators. So what we did, sort of a proof in concept thing here with the baseline photos on the left, and we were just trying to use the VL versus the PR with some different settings. And what we found to be true was here on the right, we sort of did the PR for this area that was treated, and we wanted to see how it compared with the natural resolution of the bruise. And you can see using the settings at the bottom there, we were able to get excellent clearance after about 24 hours. And it really helped her resolve that. And it was just an incidental bruise, but great option for a value add for our patients, I think.
So you use what setting do you go to on the Nordlys for it? Do you use the photorejuvenation?
So photo rejuvenation settings. And I found that to be, I've tried some of the, just kind of the PRS single pulse type settings, but I found this to be the most effective. Mm-hmm. So have you used certain settings on the Nordlys for that?
No, I agree with you that it's that it seems to be very gentle, that split pulse on the photo rejuvenation settings. So when there's a lot of chromophore there for a deep bruise, it's very gentle on the patient.
Yeah. And it's just so fantastic. So thank you for asking that question. That was well timed. Just to wrap up with another case, and then we'll take questions. So this is a light and bright treatment, and this is kind of our classic patient who's a tennis player and a golfer, and came in for treatment of just, again, the background telangiectasias, some of the lentiginous primarily, and then also some resurfacing. And you can see after one really almost no downtime treatment from left to right, he had marked improvement in terms of lentiginous. And this was the VL555, really using more pigment settings, so photo rejuvenation settings, and then layering on top at the same treatment setting, the Frax 1550, just a really nice result in one treatment setting. Because this is a vascular talk, and go after blood vessels here, but I wanted to just point out that on this patient, we did treat full face with VL, and we were able to improve some of those deeper nasal telangiectasias. I think, what I would do for him today is on the same treatment setting, on the same date, I would just have the PRS here. I would go over all those nasal telangiectasias on the same date, do the VL for the whole face, and then do the Frax 1550 the rest of the way. In this circumstance, I just wanted to show that, the VL does clear some of those bluer vessels, where you can see that bluer, deeper vessel cleared nicely with the VL 550.
Can you talk a little bit more about, on that patient, why you chose VL, and in what instances you may choose maybe even a PR over the VL, both for the pigment as well as the vasculature?
Yeah, so I think for this patient, just because we were doing a full face treatment, and I think if you kind of look at this here, he had all these scattered lentiginous, and so pigment was his primary concern. And so we said, well, let's do the VL 555 is my go-to first-line pigment photo rejuvenation treatment option. So we'll go with that. I think had his primary concern been some background erythema or background linear telangiectasias, then I would have had no compunctions about treating with, PR, going for a long pulse first, and then treating Frax 1550. I'm not sure that I would feel comfortable if we were going after diffuse erythema in the background. I probably wouldn't do the sub-millisecond or short pulse duration treatments on the same setting as Frax 1550, mainly because they're coming in to reduce the redness, and the Frax makes them red for a day or two. And so I feel like it'd be sort of counterintuitive. But I think just that amount of energy and the risk of purpura, I don't want to confuse any adverse events from purpura with the Frax, risk factors there as they're resurfacing our skin.
Thank you.
So again, I think that hopefully in the last hour or so, I've had a chance to show some cases and give people a sense of what the Nordlys system can do in terms of having a maximized vascular impact and minimize the selective waveband technology, or SWT handpieces, and then the ND 1064 nanometer laser really give you a tremendous range of treatment options for patients with vascular concerns in one device. And I can't say that enough, how useful that is every day in our practice. We have 3 of these Nordlys devices because each of our offices wants to have this tool. And so it's been super useful. I think the risk minimizing features of SWT, such as the light and the water filters with sub-millisecond pulses, really help to optimize our treatments so we can highly target vessels while avoiding overheating of water in the skin, and treat at different treatment depths. So you have the PR all the way down to the NDAG. And then just kind of as a side note, as we commented on this light and bright treatment, layering treatments, because we're using lower fluences and increasing our safety with that, we can layer multiple different treatment modalities on the same date with high efficacy and low safety, and in one treatment session accomplish really great things for our patients.